working, some of us are working towards retirement, and some of us have other goals. Jenn Crawford, who's giving our first speech tonight, is working toward the goal of tenure and promotion at Washington State University Extension. And tonight she'll be giving a presentation that will be part of her He is seeking to be assistant, or are you an assistant professor? And your field is in human and family development. Jenn's giving speech number 8 tonight, visual aids. Her speech is Strengthening Families, Why, Where, How, and So What. Jenn Crawford.
So a bit of background and context. This portion will be close to 5 minutes long, and it's featuring primarily one of 3 programs called Strengthening Families Program. Some of the slides in the beginning introduce myself, and time allowing I may do that another time between now and next month, July 22nd, 23rd, around there. So my name is Jenn Crawford, and I work in Chelan, Douglas County, as you can see in the map, right in the center of the state. My audience, besides being part of Chelan County and the local area, in this context, you may also consider yourselves as part of the Extension Youth and Family Unit, which is statewide. There's about 50 folks, and about half of them, or a third of them, are tenured faculty, and they will be making their recommendations. Some of the partners who I work with are mentioned here. And I'd like to bring to your attention, not my shoe, or my foot, but changing demographics in Chelan and Douglas counties. Things to pay attention to are that right now a little bit under 30% of the general population in both counties is comprised of Hispanic folks. But look at the range, the gradated range in both counties of that bring out the increasing Hispanic population. If you look among young children, about half, a little bit under half in Douglas County, and more than half are Hispanic. And if you look at the seniors 65 and above, it's less than 10% in both counties. So keeping that in mind and context. I am a systems thinker. What that means is that I pull information from multiple sources, and I'm always seeing how things are interconnected. And 2 major lenses through which I view the world and act in the world include one model more familiar among academics, Bronfman Federer's social ecological model, which looks at various levels of engagement for change and influences on well-being, and well-being can be viewed at the individual level, the interpersonal level, at the organizational level, and so forth. This represents another major influence of mine, which is comes from yoga philosophy, which is reinforced more these days through growing discoveries in brain science and so forth. Basically, we all share the same basic needs. All of us want to thrive. And there's sometimes barriers and sometimes supports that can make that more possible. A lot of our work involves finding the appropriate support so that more folks can thrive. And the Strengthening Families program is one particular, I'm skipping these next slides to get to the point of Strengthening Families program. which is a prevention program. It's very widely researched. It existed prior to my joining on as faculty, and I've grown the program in the past few years. The other two you've heard of. In the beginning of my time with WSU Extension, the first year I did a needs assessment, which involved multiple interviews. I also looked at a lot of other organizational needs assessment and data. I met with educators, I met with community organizations. I asked them the same set of questions, and 90 people in total came up with these three themes that seem to repeatedly present themselves as issues in the community. Here's a graphic representation using a fun program that you might, actually most of you guys have already used it, where you can put a whole bunch of words in, and the ones that are thicker and bigger mean that they came up more often. Keeping in mind I was asking about needs of families, but here some interesting things show up. Poverty, housing issues were prominent then. So the Strengthening Families program is an evidence-based program that occurs at the community level, primarily in schools, and we know it works through multiple sources of information. It's developed for parents with their youth, ages at the preteen age, 10 to 14. Up to 12 families typically participate at a time. It's comprised of 7 sessions, 2 hours each night, followed by a dinner with facilitators. We involve childcare, and it's very experiential and interactive. You'll see that we use multiple modalities to engage with families and kids. There's separate sessions for the youth and the parents the first hour after the meal, and the second session the family comes together and they build on skills that they've learned. It's one of the most respected child abuse prevention programs that exists, and very core themes are covered often in each session, and they are built on and reinforced. It's one of the few programs that involves the whole family together, rather than just a separate parenting education program where the kids are off somewhere else. But they're both working on developing skills and then coming together and putting them into action. So empathy is a theme that's covered. Roles and responsibilities, their structured activities, expressing appreciation to family members. These numbers here represent which nights families or youth, parents, youth, and families cover those topics. And you can see that there's multiple ones. Communication, protecting against substance abuse is covered the whole time. Here's a picture of one of the family sessions in which it is a game, yet folks, youth and their parents together go through this activity to learn about how they both literally and figuratively work in tandem, and that they are a unit. One person might advance a couple of squares, whereas the other, and they are attached at the ankle, and they have to find a way to get from the beginning of the series of squares to the end of the series of squares while still being a unit. So it's something fun, it's a game, they reflect on it, and it works. These are the specific outcomes that we evaluate, and we evaluate both parents and youth assessments. And matching 24 programs that occurred from Bridgeport to Leavenworth and everywhere in between. These parent assessments demonstrate equivalent improvement in their own ratings in all of these areas. And same with youth assessment, which is interesting to note because in many locations, right here, the blue, the shaded blue represents Chelan County and it's compared to Washington State. You can see they're pretty equivalent and you can see a gradated improvement in their Likert scale ratings. So they're asked at the beginning of the program and the end of the program how things are going in their home. And there are questions that are pulling from multiple sources. One is the Washington Healthy Youth Survey, which occurs every 2 years in the school system. And these are based on protective factors that are shown to increase outcomes and reduce alcohol initiation and use. There's been multiple organizations that have calculated the value to society for the savings to society for every child that does not initiate use of alcohol or drugs. And it's based on arrest, incarceration, adjudications, costs, future earnings, and so it's about a $3,000 estimate. And based on the number of youth who've done this, it's been more than 1 million saved in Chelan Douglas counties. I also looked at the recent alcohol use rates based on healthy youth survey data, and we can see that across both counties there's been a significant reduction at grades 8, 10, and 12 in both counties. And that concludes the Strengthening Families program. This will stop making noise in a little bit.
I can't hear it anyway.
Okay.
Timer, could we have 1 minute, please, while